could you let us know when the webcast has started? And we're live now. Thank you, Simon. I'll let you take it away.
Right. Well, good afternoon, everybody, and welcome to this extra decision day. I would like to go through a few points in the report, but before I do that, perhaps I can ask, do we have any deputations? Do we have any deputations?
Sorry, Councillor Gravesky, my microphone wasn't unmuting. No, we do not.
Right, thank you. So moving on to the report we're gathered together here today for, asymptomatic community testing for COVID-19 in Hampshire. So if I could hand over to you, Simon, to take us through the paper, please.
Many thanks, Councillor Gorski. So this is a decision day brought at urgent notice due to where we are in the pandemic, and it seeks approval to spend and enter into a collaborative agreement with the Department of Health and Social Care to establish asymptomatic testing sites in Hampshire. I will just give a little bit of summary and background and then talk about through the recommendations. So we know there's been good symptomatic testing across Hampshire for a number of months now, based in a number of different ways. So there's home testing, there is a regional testing site, and then there is walk-through sites. And that's for people with symptoms. Asymptomatic testing is to identify people without symptoms. We know up to a third of people with coronavirus have no symptoms, therefore may spread it unknowingly. This is a programme that's been trialled in a number of other areas, most notably in Liverpool, and we've taken the learnings from that. The programme uses lateral flow devices, which are swabs that don't need a lab and can be done get a result within 30 minutes to an hour. And the fact that it's more rapid is really helpful, and that balances against the fact they're less sensitive than the PCR test for sensitive people, mean that some positive we missed. But the aim of this programme is to break the chain of infection. So actually any positives we pick up is a really positive way to identify people and ask to isolate. So the proposal is that we will test front-facing, frontline workers who are having to go to work. So that's people not covered by other programmes, including early years settings not covered by other national programmes, retail, including supermarkets, construction and maintenance workers, some transport workers, and the volunteers who are supporting local authorities, and also any local authority frontline workers. There's a limited licence for lateral flow, so therefore we need to do those in sites, and we are setting up sites across Hampshire. The paper sets out the number of people we're trying to test twice a week. So far, we have submitted under my delegated authority a bid for Rushmore, and this paper is to seek approval for the projected 8.6 million for the rest of the sites in Hampshire, for up to 11 sites. Some will be run by, some will be operationalised by the districts and some operationalised by the county. And the paper also recommends to delegate authority to myself in conjunction with Councillor Grajewski to have all the approvals in place to set up the testing, subject to the bid being successful and receiving that notification from the Department of Health and Social Care. Very happy to stop there and take any questions.
Right, thank you. As I said, I do have a few points I'd like to tease out in the report, but before I do that, Councillor Huckstep and Councillor Keast, do you have any questions or comments that you'd like to make? Councillor Keast.
Thank you, Chairman. I understand, am I right in thinking there are 11 sites throughout Hampshire proposed? Is that right?
Yes.
So that's the plan, up to 11 sites. Obviously, it's a fast-moving piece. So
do we know where these are going to be?
We are working through those. Should they be approved, we will then start to publish those for the communities to understand where they are.
Mm-hmm. We don't know at the moment.
Well, that's not public information at this point in time.
Okay, thank you.
Yeah. Okay. Just following on from that, Simon, my brain's just gone blank. I'm going to ask something about that. Yes, so we are currently sorting through the sites. If the question comes to mind again, I'll ask it later. Do you have anything to say, Councillor Huckstep?
Thank you, Madam Chairman. I'll be as long as I can so you can gather your thoughts. Basically, Simon was very good. He briefed me on a number of questions that I had on Friday. So I don't have any questions now because they have all been dealt with. Is this a meeting in public?
Yes.
Have we got public attending?
I have no idea.
No, so for
Probably
virtual
in the
meetings, Councillor
thousands.
Huckstep, unless there's a deputation, they're able to view the webcast and follow along, but they don't actually join the meeting unless there's a deputation.
Right. Well, I had various questions of clarification. I just wondered whether teachers might be mentioned in paragraph 12. I wondered whether in paragraph 14 the numbers would be reasonably equally distributed across the piece, across Hampshire. And I asked about numbers paragraph 23, where does 611,772 come from? And that's because of the projected number of possible tests that might take place. And I checked whether there needed to be a HASC involvement, and I'm assured that there isn't, although Simon is very happy to make some statements on this at our HASC on the 1st of March. It's otherwise being scrutinised by the leader in his special committee. So I'm very happy with the recommendation. I think it should go ahead. I have thought of one other thing that I might have asked Simon, and that is, if we find people in the test who are testing positive, is there any follow-up to look at their genetics? Because it might be that we can discover which people are more likely to be asymptomatic if we know something about their genome. But that's out with this particular project. I understand that.
Councillor Huxley, that's a very interesting question. If I could just, Chair, just answer the first few questions.
Yes,
with regard to teachers not being included in this list, that's because alongside this programme, there's a number of other programmes that the government's rolled out, and that includes for secondary school teachers and primary school teachers, which is why there's the line in there that says early year settings not covered by the national programme. If you're an early year setting, so a nursery school connected to a primary school, you're already included in a lateral flow programme. Other than that, you're not. With regard to genetics of the people, no. However, those people who are positive on the lateral flow will go forward for a confirmatory PCR test through the normal routes, and the genome of their virus will be undertaken for a certain proportion, as we are, to find out which kind of variant they've got. But a very interesting question about the asymptomatic, and something we can question Public Health England about.
Thank you, Roger. You mentioned the HASC, that this report hasn't been to the HASC because it's been brought forward so quickly, so that we fit into the funding window for the 6-week programme. So I am, mindful of the fact that it hasn't been through scrutiny in that way, which is why I perhaps want to tease out a few things in the report while we're here, perhaps more so than I would usually, and I've already spoken with Simon to ask some questions. Before I just do that, can I just thank Simon and the team for putting together the report so quickly? Because it's only a few days ago that this was nowhere, and now we've got a paper and a proposal before us. At paragraph 12, Simon, could you say a word or two about businesses? Because testing was going to be permitted for businesses which employed 250 people, and now it's come down to 50. Could you tell us perhaps a little bit about that and where that fits in alongside this plan?
So you're right. It's a fast-moving piece of work, and thank you for that. Thanks. I'll pass on to the team. With regard to companies, originally there wasn't an offer for companies. We were developing that, and then it changed, and companies with 250 employees or more could access lateral flow through what's called the companies portal, and then that was changed last week to companies of over 50 employees. So what we know now is those companies can access the lateral flow through their own routes and run their own programs. So any under 50 can come to our program if they're front-facing workers. Any over 50 can go through their own company portal through the DHSC portal file.
Right, thank you. And just to confirm, where one of the groups talks about employees in retail, including supermarkets, at the moment, unless the rules change, that is essential retail.
Absolutely, yeah, just essential retail. Apologies, I could be clear on that.
You've already answered my question about the venues being secured, and I know you're working hard to get those venues secured, where hopefully they're going to be accessible to everybody. Moving on, yes, the finance, it's an awful lot of money, isn't it? £8.6 million. And Councillor Huckstep and Councillor Keith, I've already spoken to Simon about how that will be paid, and it's going to be a staged payment. At paragraph 26, it talks about costs possibly being incurred that aren't recoverable, but I'm assured and I'm satisfied that we have enough money in the Contain Outbreak Management Fund to cover any costs that might arise. And at paragraph 27, it talks about, I'll just read this out, a Hampshire Community Testing Working Group has been set up to provide specific oversight for the community testing programme. This group will report to the Strategic Testing Oversight Group and Hampshire Health Protection Board via the Outbreak Control Working Group. And then, so that we have transparency and the information is in the public domain, it will come to the Hampshire Local Outbreak Engagement Board, and I think you confirmed that for me this morning, Simon.
Absolutely. Apologies, paragraph 27 should add that in. You're right, it will come through that route, and the Local Outbreak Engagement Board and members will receive relevant information about this programme. Right. And I'm sure Dave might want to come in on some of the finances. So we are doing this at pace because it needs to be done at the right stage of the pandemic, but also the funding of the £14 per lateral flow carried out is at this point in time up until the end of March. So we want to do that quickly. But there may be some costs if a site needs to set up before they are approved, and that's happening in another part of the country. And then they're not approved, and I don't see any reason why the Department of Health won't approve our bid. Obviously, there would be cost incurred, but other than that, we're comfortable with that. And we've got a Contain Outbreak Management Fund, which would be able to cover any costs that aren't covered in this way. OK, thank you. You mentioned Mr. Curden there. Do you have anything to say, Dave?
Yeah, I think it's probably worth highlighting that this is quite fluid, and we were discussing these bids earlier on this morning as a working group, and they are changing because obviously there's two things: there's demand, or what we think the demand will be, and our capacity to meet that demand, and those things are changing, literally hour by hour, as I'm sure Simon can testify. I think so. It's important to say that within the report that you have there, you certainly have an approval amount which more than covers the likely cost of the 11 bids for those 5 weeks. Probably far exceeds the likely cost, but we wanted to make sure we had sufficient coverage for those costs, so that we didn't have to seek another approval. I'll just stop at that point. We'll see Jennifer Watson Legal's got her hand up, so I'll just make way for Jennifer.
Thanks. Jennifer.
Hello. I just wanted to build on what Dave said about the fluidity of this and just draw your attention in particular to the last recommendation, which does, as Simon has said, refer to delegating decisions to him in consultation with you. That's to cover all the further work that remains to be done and the finalising of quite a lot of detail around this
Yes, thank you. And understandably, there is still work to be done, and things are having to be done in parallel. When will we see the communications engagement plan? And I ask that because there may be people watching this now or watching it on YouTube later, you never know, who say, oh good, I haven't got symptoms, I want to get a test, where do I go, how do I get online? When will we have that information for people? Because they, once this information is in the public domain, the questions are going to start being asked.
Absolutely, thank you. It's absolutely right, we get that correct. Whilst we're still finalising the bids and how it's going to go in, we need to be really careful, and we haven't had any approval from the Department of Health to go ahead. So we're working on the communications. As soon as it's all public, there'll be communication through our usual channel, and Jane Vidler, our communications manager, is on the line. She's preparing that, including making sure that one of the key things is we target those people who are less likely to uptake testing but still going out to work. So we'll be doing all that work as soon as we've got approval very rapidly, remembering it's a 6-week programme, so it may well build up after 1 week, so that then people get tested regularly for the next 6 weeks.
Turning to paragraph 28, 29, the equality impact assessment. This is incredibly important. I mean, addressing inequalities is important in every decision that we take. I think it's super important here to ensure that the scheme is equitable as well. And I just wonder how we're going to reach these people without going into too much detail. I know we're going to be doing, targeted communications in the usual way. But when it talks about deprivation, we see lower uptake of symptomatic testing. People don't want to have to self-isolate because of the financial implications for them. Are we going to be able to provide them with any advice and support to help them self-isolate, particularly if they feel okay and haven't got symptoms?
So it's a really good point, and we are working. So our district council colleagues implement the isolation payments for those who need it. So we'll do a lot of work, and again, our Hampshire County Council communications team has put that out so that people understand that there is support for them should they need it in the right way. And I think also we will make sure that we work with those community leaders who can encourage people to get a test. Now, obviously, we need to be kind of mindful that some people will need to travel, but if we can help through their workplace to say, we'd like to get a test, there's a number of ways we can do that and get workplaces to help with those messaging. And also, in things like languages as well. So there's a number of ways we can do that to encourage those to take up the test. But as you say, it's something we need to be really mindful of, having seen the evidence from the symptomatic testing.
And has any thought been given to people who in more rural districts are going to access these sites, because there's only going to be one site per district, and also how people with disabilities, which might include their mobility. Obviously, disability doesn't just mean that people have mobility problems, that they could be disabled for other reasons. But has any thought been taken about how to ensure that people do have access to the sites?
You're right. So the actual physical access and the kind of for someone who's got any kind of impairment will be in line with all the regulation as you'd expect. I think we need to bear in mind this has been put together very quickly, and we wanted to get going with one site per district. But however, if we're finding that very quickly we can move on, we can amend our bid, as it were, to Department of Health and add in another site should that be required. So there's a number of things we can do fairly quickly, and depending on the government announcements on whether this is carrying on, or actually we may find that it is worth continuing for another week or so, we can amend the bid as we go along, or put a kind of an amended bid in, which will of course be in consultation with yourself.
Yeah, and I think it's important that we your department's used to working in an agile way, and look at the data, look what we're seeing, look at what the picture is, and then take action to
absolutely
plug any gaps and so on. So I appreciate that work will be ongoing. turning to the risks, I've looked at those and I've noted your comments at paragraph 33. However, having had discussions with you, I think I'm comfortable that all the steps that we can take have been taken to mitigate the risk. And I don't know, Jennifer, if you have anything you would like to say on that.
I can come in before Jennifer. Jennifer, do you want to go?
For a minute, I thought I got your name wrong.
No, sorry, it was just a bit slow. Yes, the paper does refer to these risks and also to the fact that we're seeking clarification still on a number of points. So there is a lot of uncertainty in relation to what's covered in paragraph 33. Simon, did you want to add anything there? I know you've already provided information.
Yeah, yes, Chair, you're absolutely right. One of the challenges is getting that clarification on the different roles and the different authorities and the different risks. So the Department of Health's responsibility will provide the standard operating procedures, supply the testing, and then we'll carry out the tests in that area. So it's a partnership. It's just making sure we're all clear about that. As Jennifer said, we need to make sure we're really understanding the right processes. We will be putting in clinical governance arrangements for that with someone in mind to really help oversee that programme for us so that we can make sure all the clinical aspects are covered, because this is a clinical medical test, even though symptomatic. So we need to get that right, and we're doing that really carefully and working with the right employees to deliver that programme.
Of course. Right. Thank you. Well, I don't have any more questions. So before I wind up, Councillor Huckstep, you have something you'd like to say, and then Councillor Keast.
Councillor Keast was actually before me, but
was he? I thought you flashed up first. Sorry.
Yeah.
Carry on. You're there.
I've only been waiting 20 minutes, Roger.
Oh, have you? I'm sorry.
No, that's all right. Part of my questions haven't been answered by Simon. I was really the two questions I had. If that's all right to just go quickly through them. One was, are we hoping this is going to be cost negative to the county, or is there a cost to the county? And second, or if there is, are we going to be able to get that money all back? And the second question was the involvement of local councils. They do work on a totally different level to county. Are you confident they will be able to work? Are you working with you in order to deliver this?
So the first point is we'd hope this to be cost neutral, so that actually the £14 a head, we're planning it so it covers the cost of the tests. However, we are aware that this may, if this doesn't happen, we've got what's called the Controlled Outbreak Management Fund, which is just for some of these programmes, and we'd always put some money aside for testing should it be needed. So with regard to the council, it will use the money we've got for controlled outbreak management, whether that's the Department of Health £14 a head or the funding we've got already. You're absolutely right, the district and borough councils work differently to us. This is still our programme, but in many areas they're going to operationalise that for us. For example, using their venues, we might be using a leisure centre in one or an office in another. So we're working with them to operationalise it as a kind of a delivery partner, as it were.
Thank you.
Thanks. Roger.
Yes, interesting actually. The first question that Davey had asked was very similar to mine. Mine's the corollary really, and that is, I think Dave might need to confirm this, but is it true to say that we can sustain a shortfall by about 28% of people taking up the test, and that will be covered by the differential between the £14 and the £4?
At this point in time, the expectation is that the actual cost per test, as per the bids that have been provided to date, is significantly lower than the £14. The £14 is an up to figure. There's no expectation that we would be able to claim £14 if it only cost us on average £10.50 to provide each test. We'll only get, in effect, the costs reimbursed. So at this point in time, there is a significant amount of scope for, if we have got within the bid our costs slightly awry, or there are some unintended or unexpected events, there would have to be a significant volume of those events in order for it to exceed the £14. But the government, within the guidance, have made very clear that if for whatever reason we have a lower than expected uptake, that they would be open to a conversation around how that they can ensure that no local authority is losing money as a result of this operation. But we do, as Simon has already stated, we do also have the fail-safe, as it were, of the comp funding should there be any scenarios where the government are unable to make good any increase in costs or unexpectedly low volumes of activity.
Thank you, Dave. That's very clear.
Thank you. Do you have another question, Councillor Hochstedt?
No more questions, Madam Chairman.
Thank you. It's just your hand is still raised. I've seen it this time. Okay. Well, I think that we've talked about the risks. We've talked about the benefits, and I think the benefits outweigh the risks. And I think this is one more opportunity, another string to our bow, if you like, to identify cases and trace contacts in the all-round effort to stop the spread of COVID-19. Simon, you've already said a third of people don't have symptoms, so this is a way of getting to those people and finding their contacts. In fact, something that's going to enable us over a period of 5 to 6 weeks to test over 500,000 people without symptoms, I think is definitely worth investing in and progressing. So I'm happy to first of all note the application, the recommendation at number 2 that the bid has already gone in for Rushmore District, and to agree the recommendations at 3, 4 and 5 in the report.
Thank you very much.
Do I need to read them out?
They have been published, Councillor Gruevski, so I think we're fine, and we'll follow up with you directly after the meeting with the DRs and then publish the decision records as well. So all of those recommendations will be laid out there. Thank you. Thank you, everyone.
Yes, thank you very much.
FM, could we please end the webcast?